12:06 right here on 90.3 FM. It's Wednesday. That means it's time for Helping Seniors of Brevard. John Harper with you, along with Kerry, Fink. And Kerry, good to have you back in the studio here with us. Not that you weren't here last week, just good to be here in the studio and get today's edition of Helping Seniors of Brevard underway. Joe Steckler is on the mend. And hopefully Joe will be back here with us shortly. And Kerry, did you know today, interestingly enough, what a difference a year makes? Today is the 1-year anniversary of the first reported case of COVID here in the United States in Seattle.
Wow, how about that, John? And, you know, it's really pretty amazing how much progress that we've made here along the way. What a difference a year makes. You know, normally today, the third radio show, third Wednesday of each month, you know, our regular guest is Barb McIntyre with Reverse Mortgage Funding. She's our she's our go-to person whenever we want to know anything about those kind of things, and she's always a joy to have on the radio show. Today, though, John, she is literally one of the people getting her first shot on the COVID vaccine. So I guess what I would say is what a difference a year makes about all that. I was talking to Joe last week, and you know, he's had no problems with his. Did you have yours last week?
Had it last week, and absolutely no problem.
See, and that's the reports that we keep getting from everybody. So it's really encouraging that you know, I think we have a lot to look forward to this year. In fact, if as we all get vaccinated and get past all this, the latter half of the year really should be an exciting time. And so today with us, in the absence of Barb, who will be rejoining us soon, we also have the pleasure of welcoming Dr. Kevin Kilday, another longtime friend of the Helping Seniors organization. How are you doing today, Dr. Kevin?
Doing very well, thank you. I'm glad to be here.
And for those of you that may not be familiar, Dr. Kevin Kilday is the operator and owner of Holistic Health Center US, and we're going to have a good discussion today about keeping your brain sharp, among other things, John.
And Kerry, we might want to mention right now, we just got bulletin news that President-elect Joe Biden is now officially president. He was just sworn in a minute ago, making him president number 46, president of the United States, Joe Biden.
Oh, that's what you got to love about this country. No matter how you feel about elections or things like that, it's great that we live in a country where we can have a peaceful transfer of power. And, it's just exciting to see democracy at work like that.
A little debatable considering 2 weeks ago.
Well, I think we've moved past that.
But having over 26,000 troops there in D.C. But nonetheless, you were speaking here a moment ago about COVID. We were talking about this being the anniversary. It's kind of terrible to say anniversary. That's usually something positive for the most part, but it's been 1 year since the first case was reported here in the United States in Seattle, and we've come a long way as far as being able now to distribute the vaccinations. In fact, Florida is one of the states, Kerry, Fink, in the nation that is really kind of leading the way in being able to give the vaccinations to our residents. And some people, some Americans who are not residents of the state of Florida are coming over the border and taking advantage of the way in which the state of Florida is set up to give the vaccinations. We are doing a pretty good job. We had an interview last week with a colleague of ours in Los Angeles, and Los Angeles going in just the opposite direction as far as being able to get their citizens vaccinated. What a nightmare out there. But nonetheless, on the positive side, things are moving forward here in Florida. Governor Ron DeSantis was here yesterday, and he spoke at the Publix supermarket in Vieira, the one right by the stadium, and by the McDonald's that I know there all too well. And nonetheless, he was talking about now here in Brevard County, the Publix supermarket and their pharmacies will now be able to give vaccinations right here in Brevard. So let's give a listen to that conversation.
The fact that you have people all over the world wanting to come to Florida, you can't say we aren't doing shots, because if we weren't doing shots, people wouldn't want to get it. So I do think it's the fact that we were the first out of the box to put seniors first. You have some people in some of these states, they haven't, if you're 72, you're not even eligible for a vaccine yet. You look, we've done almost 400,000 people between 65 and 73. I think it's about 350,000 just in that age group. All those hundreds of thousands of people, most states you wouldn't even be eligible yet for a vaccine. So we're proud of progress, but yes, we want our Florida residents, and that can include people that live here half the year, but it's not for people that are just visiting.
Governor, you mentioned the villages, the site there, and I think you probably saw this week they told a lot of people who had signed up that they had to cancel their appointments because there was a shortage of vaccine.
Yep.
Do you have any information about why that happened and when they'll be?
Because they're going through it. We've told everyone, go through the vaccine, use what you got. You run out, then we need the federal government to send us more. But if you have people in line, you have people ready to go, you're going to do it. Use it. We want everyone to use what they have. It's not they should not try to not use it. If there's people there who are signed up, do it. And like I said, we are fighting to get more vaccine. I tried to get double for this current week. Just didn't do it. They gave us about 270,000. But as I said, we're going at such a pace. We're going to go through all of that for sure. But if you have it, use it, and then we're going to work to get more. They talk about if anything's going to change with warp speed and all this. A lot of the stuff I'm hearing is totally not necessary. Like building these FEMA camps, that's totally unnecessary. First of all, that would take forever to do. You're adding more layers of bureaucracy. Just imagine having FEMA then have to, what are you going to do, handle the appointments and all this stuff? When you say first come, first served, there's lines when you do it. So the only thing the federal government should worry about right now is increasing the vaccine shipments. Not just in terms of the number generally, weighting it for senior population, and then rewarding the states that are doing good job with throughput, because that's really what we're doing. But if they're doing it right, if the federal government's not increasing the vaccine coming, there will be shortages of it, because some days we're doing 80,000, 85,000 a day. If you look last week, we had a couple of days we were over 80,000. So what that means is if you're only getting 270,000 for the week, you ain't gonna last 7 days a week with that, and that's just the reality. So yes, ma'am.
Yes. Will there be any problem with the second one?
The questions only from the first for
3 weeks after the first.
Yeah, I'll answer that in a sec. Yes. Yeah, so I actually talked to the FDA commissioner last week. So the data looks promising. I don't think they know whether it's effective across all age groups yet. So that's one of the things they're looking at. I mean, it may be that the Pfizer, Moderna are better for seniors. Maybe J&J's better for younger people. They haven't come to that conclusion yet, but they are optimistic that it's going to be safe and efficacious. That will then likely, if that's all true and the data comes in, be approved in February, at some point in February. And then the only question is, what's the production? We had, I think, been anticipating really widespread production right off the bat. I'm not sure that that's necessarily the case. I think that the jury's still out on that. But if you're able to get pretty good production, you have one dose, that's perfect for kind of people that are in the workforce and all that. If you do it once, you don't have to worry about it. Probably don't want to have a lot of those folks having to do the 2 doses. Like the seniors are very diligent about this. They're going to want to go in and get it. So in terms of second dose, so everything that's been sent to Florida so far has had a second dose kept on the side by the feds. As the doses are used, they then send the new, the booster shots. So all that's coming. What Publix does is they'll give you the little card to say, okay, you took Moderna, you need to come in 28 days. But then what they're doing is they are then going to reach out and make the appointments with you. So that is going to happen. They're going to do that, and we know that that's important. You have to do both doses. We support that. There's a school of thought, like in Britain was talking about, just give everyone 1 dose, it's 50%, that'll be good. My view is, particularly with elderly people, I'd rather them get 95%. And if it means people like me wait longer who are younger, that's fine. I think it's more effective to do that. So that's what we're doing. If they release all doses at once, what that'll mean is maybe I get 520,000, but then I got to figure out okay, how many second doses are going to be needed over the next week and a half? What's the production schedule looking like? Right now, when they're holding the second doses, we tell everyone, use everything you have. Run out, because you don't have to hold anything in reserve. If this policy change does happen, then we're just going to need to make sure. What's going to hit for us is probably like the first week of February, because you have a lot of these seniors that when we opened it up, who are going to come due from Moderna. So you'll have probably several 100,000 in early February, mid-February, each week. And so you got to make sure that you have the Moderna for them. But you will get a card. You will get an appointment worked out with Publix as that becomes closer. And I think that'll work really well.
Governor, here in Brevard, just this morning, the Florida Department of Health here in Viera booked 2,800 appointments in 22 minutes. I know that in Orange County, they suspended appointments for the time being.
Sure.
Same in Sumter. And it sounds like what you're saying is it's not a logistical issue, it's a supply issue.
100%. Supply is by far the most significant thing. If you look at the numbers, just look at last week's numbers, what we did, doing over 70,000 shots a day, 80,000 some days. We could do over 100,000 shots. So like some of these drive-through sites, like the Villages, we could double that probably. Hard Rock Stadium in Miami, we could double or triple that if we had the unlimited amount of vaccine. So that's really, I think, the most important issue. And quite frankly, like the logistics, you always have to deal with it. Publix is great. They're built for logistics. So you get the vaccine, they got a great setup. These other sites, once they get up and running, they've worked very, very well. I mean, I visited probably about 15 or 20 different sites between Publix, drive-through sites, all this, and people are really happy with how they're running. I know there were some kinks early in some of the counties, but I think most of the counties have done a really good job at this point. A lot of the hospitals, I mean, in Orlando, the hospitals are doing very well. Miami, the hospitals, Brevard, they're doing really well. So we have all these different ways to be able to get the vaccine, and what we're doing is just sending it to the people that are using it. And we thought maybe some would just be so inefficient, but really I could do twice what I'm doing right now because people are getting it through. So I would just tell seniors, it's just a matter of getting more vaccine. We were told we were going to start getting more for next week. Then we've been getting on these allotments. And then if they plus up because of demographics, Florida would benefit. We have the second highest population percentage of seniors of anywhere in the country. And so we will stand to benefit from that. And then if they end up doing something with the second dose, we're going to have to make judgments about how steady is the supply and the manufacturing of Moderna and Pfizer, and how do you do it? Look, there's really nothing wrong with using the second doses for first doses if you know you're going to get more and the time comes, because we do have doses that the federal government's holding back that aren't going to be used until February at the earliest anyways. But you got to do that right, and what you don't want is people not to have the second dose. So that's what we'll be looking at, and I think we'll be able to, we'll make the most. Whatever they send us, we will make the most of. But at 270,000, you just look at the first 2 weeks of January. The 4th through the 7th was 350,000. Last week, over 400,000, and the numbers aren't all in from last week yet, and that's with a holiday weekend on Sunday where it probably would have been higher. So the throughput is there. We just gotta make sure we have more vaccine.
One more right here. The vaccines that are coming to Publix in Brevard, will that affect the vaccines that are going to the health department in Brevard or to other counties?
I mean, it doesn't affect it necessarily, but we have 270,000 to a portion. Obviously, we're going further with Publix now, and so you're not getting as many shipments in some other areas. There's some hospitals that may not get anything this week because they still have some. So we're just trying to use it so that wherever these 270 go, they're going to be used this week, and it's not going to back up. Now that may mean a health department may get less shipment, maybe they'll get the same. I think it all just depends on the throughput. But at the end of the day, we wanted to expand Publix because it's been successful, and this is something that I think people appreciate. You know, the seniors, they've been going to, a lot of them have been going to Publix anyways this whole time. Not everyone wants to go into a hospital. Not everyone necessarily even wants to do some of the drive-through, especially if they have to drive far. But to drive a mile or two to the supermarket, we think that is very, very convenient for folks. Okay, well, we're going to hopefully be able to expand into more Central Florida counties with Publix, and we're looking forward to it. I do want to thank the folks, though, who have been working in Central Florida, the hospital systems and stuff. I think they've done a great job, but we think that this is a good model. We'll obviously keep getting feedback, but I mean, the feedback's been uniformly positive, so I have no doubt that people in Brevard are going to appreciate having the vaccine at their local Publix. Thanks, everybody. Yeah.
So, Kerry, Fink, good news that Publix supermarkets and the pharmacies within the supermarkets, and 22 of them here in Brevard County, will now be able to distribute the COVID-19 vaccination shot. And you just heard that it looks like Brevard County is almost one of the model counties in the state for being able to get the vaccinations out to the public on time.
Yeah, you know, that's really the important part is, I guess it's, we've talked about this, patience is really the virtue through all of this. It's been that way about staying safe with all the precautions. In fact, yesterday, Dr. Kevin Kilday and myself both attended a Golden Providers meeting where they were talking about just that topic about, needing to keep the precautions in place even as people are getting vaccinated, right, Dr. Kevin?
Yes, it's still very good until we get a total grip on this COVID-19 to continue the the safety protocols, at least for until the government says it's all clear.
Yeah, I think that's one of the things, one of the lessons that we've learned along the way as we've been doing the Helping Seniors updates and then talking with the different providers that are connected with Helping Seniors around the county, whether they be assisted livings or whether they be people who are going into seniors' homes and providing home health care. They all say the same thing. If we stay diligent about our universal precautions, meaning the hand washing, the social distancing, the wearing of our masks, stay home if you're not feeling well, all those things really seem to make the difference. And we've been able to stay safe through all of that.
Kerry, it bears mentioning, it wasn't brought out during that interview with the governor a moment ago, but to get more information, or specifically to get an appointment with the Publix pharmacies to sign up for the COVID-19 shot, you need to go to a specific website. It's publix.com/COVID. It might be COVID or COVID-19, but that's what you need to go to in order to get signed up for the shot. Now, Publix just started that today, and unfortunately today they're already booked up, but you're certainly being advised to check back frequently, and you'll be able to, if you're patient, you'll be able to get signed up and get your shot ready to go. And that certainly is good news for the residents here in Brevard.
Yeah, and I think that, again, goes back to that key word of patience because, like I said, we've made it this far, and we've also been able to determine that we can stay safe so long as we do take into account all those CDC guidelines. And if you think, John Harper and Dr. Kevin Kilday, those haven't changed, actually, since the very, you were talking about it being a one-year anniversary, but all the precautions are really the same as they have been, and they will keep you safe. So we can afford to be patient, as you heard the governor talking about. The thing I do like is that we are a state who has put, at least as far as the vaccines go, seniors first, which is the way it should be, because it's the most vulnerable population. Remember what happened early on with all this stuff, and it definitely seems beneficial that we're looking after our seniors. But then the other aspect of it is that over time, when they're doing, like he said, based on however many doses they're able to get in, it will catch up very, very quickly. So we just stay safe a little longer. It seems like within a couple of months, we'll have all seniors vaccinated and be moving on to the rest of us, I think.
Yeah, I mean, I can't wait. I haven't made my appointment yet, but I just don't care for waiting in lines and things like that. That's just me personally. But I'll be getting mine soon.
Yeah, and we'll keep you posted several ways. That is actually one of the missions. Joe Steckler, our president and founder, has always made it the mission of helping seniors to get information in the hands of seniors throughout Brevard County. So one of the things we did actually to rise to the occasion of COVID-19 was to create a thing that we do online called Helping Seniors Updates, where we are trying to make sure that anytime something is happening, we're getting that information into the marketplace. We were putting out there, for example, when the Brevard Health Department was making appointments, those got snapped up, as you heard the governor say, very, very quickly. And I'm sure it's going to take a while for Publix to get to be able to manage the demand that's going to be happening. But we'll keep you posted. So there's a couple of things that you want to keep in mind. One is helpingseniorsupdates.com, helpingseniorsupdates.com. That is specifically where we put all the latest information that we have access to about what's going on with the COVID and the vaccines and everything like that. And then the other place, of course, John Harper, is that you get to hear about it because we're making sure we stay on top of it each week on the Helping Seniors radio show right here on 90.3 WEJF FM.
And again, Kerry, Fink, that address for our listeners to write down, that online address to get your reservations if you want to take advantage of the public supermarkets and their pharmacies. Again, 22 locations here in the Brevard County metro area, and they're soon to be expanding to other counties as well, as they have earlier in the month. But now Brevard County is up and running. They've got a very well thought out website that you can go to and find out frequently asked questions, and of course sign up for your appointment as well, and a day of the week and things like that. You need to go to Publix. What's the address again?
Publix.com.
Publix.com /
vaccine or COVID vaccine.
/ COVID vaccine. Again, that's Publix.com / COVID vaccine, and it'll take you to the site, and you'll be able to find out who's eligible, the counties that are available, and all the information you need, Kerry, Fink, to make sure that you are knowledgeable with what's happening with the vaccines. Now, this is only at Publix, the public supermarkets and their pharmacies. That doesn't mean that you can't go through the other avenues of approach that people have been trying, as I did successfully 2 weeks ago and got my vaccine through the county. So continue trying those avenues of approach as well. Publix is not the all and end all. It's just one additional big benefit to being able to get those vaccines, hopefully in a very timely manner.
Yeah, no, absolutely. So on the second half of the show, we're going to end up talking with Dr. Kevin Kilday about keeping your brain sharp. He's actually written a whole article that's coming in the February edition of the Helping Seniors newsletter, which of course is conveniently bound into the center section of the popular Senior Scene magazine. So you're going to read that, but we're going to be talking with Dr. Kevin about that in the second half of the Helping Seniors radio show. So come back and join us for that.
12:32 is our time here on 90.3 FM. You're listening to the Wednesday edition of Helping Seniors of Brevard. John Harper with you. Now throwing it over to Kerry Fink. Kerry?
Thank you, John Harper. And so, yes, it is always a pleasure to be here for Helping Seniors Radio. You can join us every Wednesday at 12 o'clock noon. So on behalf of our president and founder, Joe Steckler, and our entire Helping Seniors team, we're so glad that you're listening along today. We've already covered a lot of good information from where our governor was right here in Brevard County explaining that vaccine is going to be available for COVID at public stores. And so it just seems like as they get the quantity of vaccines up, we're going to be better and better. But our guest today in the studio is none other than our longtime friend and holistic health expert, Dr. Kevin Kilday. How you doing, Dr. Kevin?
I'm doing very well. Thank you. Thanks for having me.
You know, we were just talking at the top of the show when John Harper was saying, it was exactly a year to the day that they first told us about the first case known in the United States of COVID happening up in Seattle. We really have come a long way, and it just seemed like we just have to really stay diligent and vigilant about all of these precautions and things.
Yes, that we do. You're maintaining the 6 feet and consistently wearing masks. Washing hands, using hand sanitizer. It's all good. I mean, we got to continue to battle and get rid of this COVID.
Yeah, and also over the course of the past year, you and I had the privilege of doing a number of different Helping Seniors updates along the way, and we covered a lot of different topics. We talked about things that were like health supplements and things things that you can do that boost your immune system, maybe in general. We talked a little bit about some of the challenges that people were having just with the isolation aspects and things that could even maybe help you naturally kind of boost your mood throughout all this. And I even remember you talking at one point about the importance of going out and getting some sunshine so that you got the vitamin D and all that.
That's correct. There has been a lot of research on vitamin D of building up the immune system, and it's very effective. Against. If your immune system is built up, then the chances are less of you getting the COVID. Mm-hmm. Even if you're exposed to it, the body can fight it off. Right. And they're finding that vitamin D is one of the most important vitamins that you can take, and you can also get it in the like you said in the sunshine. Just going out for a healthy walk in this beautiful sunshine weather we have down here, can actually give you thousands of international units of vitamin D within 20 minutes. That will last you the whole day. They're finding out in a lot of different parts of the country where their sun is not as prevalent, that there are a lot of people that are deficient in vitamin D. And actually, today's day, it's a very good idea to ask your primary physician on your annual physical to actually that they have a test for your level of vitamin D. Mm-hmm. And some primary doctors are actually just doing it, but a lot of times you just have to ask them. And it's very good to monitor your vitamin D level.
We were talking about that overall with the work that you do with Holistic Health Center, and it was interesting. We've had many conversations about how you've adapted to the COVID world that we live in. You have a place that you meet clients in regularly over the 1900 building, that you are able to do safe social distancing and take all those precautions, but now you've also got into Zoom teleconsultations and things like that. If we're going to talk specifically about keeping your brain sharp, but you're just a fountain of information that is just good to have in general. How does somebody get in touch with you? Let's give a phone number and that.
Well, I can be reached at 321-549-0711. I personally answer the phone. If you get my voicemail, it just means either I'm with a client or I'm just busy, but I would always get back to you hopefully the same day. If not within 24 hours.
And so again, I'm going to ask you to give that phone number again in a moment. So everybody grab a piece of paper and a pencil and maybe jot this down. But I also wanted to reference your excellent website, because you do a lot of things. You help people both with you have protocols that are designed to help people get out of pain. You're sort of a specialist in addiction recovery. And then you also have protocols for people who've been diagnosed with cancer, among other things. So it really makes sense to, you can find out all about what Dr. Kevin Kilday does at his website, which is called holistichealthcenter.us. That's holistic, HOLISTIC, Holistic Health Center. .com. .us. Holistichealthcenter.us. And the phone number again.
Yes, it's 321-549-0711.
Now, one of the things I wanted to ask you about in this article that's coming up, you're talking about, as seniors, as we get older, we do crossword puzzles, we do Sudoku puzzles, we do things, and we're sort of under the impression that by doing these mental exercises like the puzzles and things like that, we're probably helping keep our brains sharp. Is that true? Is that
Well, yes, that is true. I mean, there's a lot of research out there that seniors who do crossword puzzles and play games like Scrabble, to stimulate the brain. I mean, that's why a lot of the assisted living facilities, but a lot of the senior daycare centers actually keep them active all day. But I'm assuming that a lot of the senior daycare centers have been shut down during this COVID, or just open minimally. But that's not the only answer. I mean, it's a good start. Because I talk to seniors and and some of my elders in my family, and getting older really scares them. But they say that that they're really scared of mental decline in their golden years.
And you were citing in this article that you're going to want to get a copy of. It's coming out in the February issue of the Senior Scene magazine. It's embedded in our Helping Seniors newsletter, which is a feature every month when you pick up your free copy of Senior Scene magazine. But you're talking about a study that had a bunch of seniors in their 60s, 70s, 80s, and they got involved in some college level courses. And apparently, when they studied, it looked like their brains looked more function wise like people 30 years younger. That's pretty impressive.
Yes, the study was done, using college level courses, and then they after 6 weeks, the test providers, did some cognitive testing, on their memories, and they found that that their thinking and their memory abilities were similar to middle-aged adult scores, and they said their brains actually were functioning more like a person 30 years younger. So I believe this just proves that no matter how old you are, if you can continually to stimulate your brain, you're really no different than a younger person.
I'm smiling when you're talking about things like this, because oftentimes people call these things like mind benders or puzzles and things like that, and it does seem like I guess it's probably the same thing a physical therapist or a physical trainer would probably tell you, use it or lose it, as far as your physical muscles go. But it's almost like you're saying the same thing when it comes to our mental muscles.
Exactly. And you got to realize in this test also, that they were doing the regular college course, meaning that they were doing their reading, they were doing their homework assignments, they were writing essays, so they were doing much more expansion than just doing a crossword puzzle or playing Scrabble or word games or whatever. Like I said, I'm not downplaying the crossword puzzles or anything, but there's just a lot of ways out there, to stimulate the brain. You gotta, and especially now with a lot of seniors are in isolation, and isolation alone can just be very tough on you. It was tough on me during the quarantine in the very beginning of things. I'm used to being very active and very busy, and happen to stay home and have my movements limited, my activities limited was very tough. But I know seniors without a lot of them without some help or. Even the lack of visitation now is still going on in some places. I mean, that just makes them feel very, very isolated.
Yeah. Well, one of the things that's interesting, though, if you think about it, it's kind of the silver lining in the storm cloud kind of thing, is if you think about it, while we're trying to be patient and keep up with all of our precautions and all of the things that they've asked us to do to stay safe through COVID, while we are also at the same time waiting for our opportunity to get the COVID vaccine. One of the nice things, or one of the positive aspects about what we're talking about today is this is something you can do even in a kind of reduced, more isolated environment, right? Because now with courses and things being available online and
exactly.
things like that, it's not like to do this, you must get out to a classroom. You could do a lot of this at your own pace. Everybody has a computer, a smartphone, maybe an iPad. And with a little help, even if you're not super technically proficient, you could get online and maybe start working on some of these kind of course ideas or things that are really going to stretch you. And I remember too, Dr. Kevin, like, not an expert of this, but most physical trainers and therapists and people that I've talked to along the way, they also talk about there's a place, it's fine to do a little bit of things like that, but if you're really trying to train up, then there's a place where you're pushing yourself a little bit, right?
Yes, that's true too. I mean, you always have to, not just do it just for the sake of doing it. You really got to, push ahead. Like if you're in a college environment, you're pushing ahead to obtain that certification or that degree.
Yeah, there's actually a little stress, right? Because you don't want to flunk the test or do bad on your paper or things like that.
Right, exactly, and so that all helps. Also, if I can mention, there are also some supplements also that help with cognitive and mental ability. That are readily available.
Yeah, I was going to ask you about that too.
Yeah, either through me or through a health food store. Some of the vitamins, like a good. A good B vitamin complex, like all the Bs are very good for the brain. There's magnesium, which is a very good supplement. Has a calming effect, but it also has, it helps, the mind and the neurotransmitters in the brain. And it's just a very good. It's responsible for over 300 bodily functions. I think.
Wow.
Magnesium is the best. The best mineral out there to take. There's also, of course, this Ginkgo Biloba. Everybody, makes fun of that name sometimes. But
it is a funny name. But it's an herbal remedy kind of thing.
Yeah, it's an herb, and it's been widely studied, and it's very good for helping memory.
Uh-huh.
Another one is an herb out of India, which is readily available, called Ashwanga, and that is very, very good. There's been a lot of research on that also.
Now I know the best answer is to give you a call, but if somebody is intrigued by saying, like, okay, maybe I should be looking at a couple of these things, do you have like recommendations or ideas, or is that like an individual thing, like, take one of these, take 10 of these, how to?
No, there are there are certain dosages that I recommend as per the studies and as per the research. I only recommend supplements and herbs that have been thoroughly clinically studied. I don't do any things that, maybe only have one study, whatever. No, I have a half a different sites I go to, and, there has to be, numerous, a lot of studies and really showing a lot of positive results, like even before I would consider, recommending it. So there are certain dosages to take. Without seeing the person, I just tell them to follow the directions on the bottle.
Yeah.
But sometimes, I'm not saying to do this, but sometimes, as per the research studies, you need to take a little more.
Uh-huh. And this is another question that's probably related to this. I guess I'm assuming you're going to tell me it does matter, but does the brand name of what you buy, like if I walk into a drugstore and I see like a Ginkgo Biloba or something like that, there may be like a store brand, there could be 5 or 6 other vitamin company brands. How do you begin to know if there's a difference or what you ought to do?
Well, there are, some very good brands out there. I mean, I have a number of manufacturers I use that lack of a better word, investigated or checked out, just to make sure that all their product is built in the United States. That's the key thing. I had one bottle I got, in stock, and I was looking at it, and because the price was right, I was able to buy it wholesale. But I look on the bottle, and I see that it was made in the Ukraine. I mean, I packed it up and I sent it back because
you just don't know at that point,
right? You just don't know. Okay. I don't think the vitamin manufacturers have to put on there, where it was grown or manufactured. They do put on there a lot of times, manufactured in a I forget what it is. I think it's GMA facility or something like that. Mm-hmm. A good manufacturing facility. But it's very important to look at the label and sometimes in the fine print, and it would say, and some of them I've seen, made in China.
Okay.
So it's just a good idea to read the label. If you call me, and all my stuff is made in the USA, totally traceable. Good high quality supplements, and my prices are very fair and very competitive.
Yeah, so it's another reason to give you a call. And also, while we're talking about keeping your brain sharp, and we're talking about taking courses and things that expand your memory, you also are a professor with the Faith College of Natural Health. So kind of an interesting thing. You might be able to do two things at the same time. You might be able to be expanding your brain and keeping it sharp, as we're talking about, by taking some college-level courses. And you might be gaining some real insight and understanding about holistic health and maybe the things that you want to do through the courses that your college offers.
Yes, I've been very blessed to be involved in a new college called Faith College of Natural Health, and it's all about alternative medicine and natural health, holistic health, and we are training people to be certified as health coaches. Offering degrees in natural health and holistic health, and offering from certifications all the way up to doctorate level degrees.
Wow.
And it's all online. Our website is being rebuilt as we speak. There was just a lot of changes and new courses added, so we just decided to redo the whole website. So, you can still call me at that, the number I gave out before, or there's another number to call, for the college.
Let's give out your number, because you really are the point of contact for all of this stuff. So one more time, everybody grab a pencil and jot this down in case you didn't get a chance to before. I'm going to say his website again is holistichealthcenter.us. Holistic, HOLISTIC, center.us. And your phone number, Dr. Kevin?
Yes, the phone number is 321-549-0711. And that's for the Holistic Health Center. And you can also call that number, too, about this new college that I'm involved in. And like I said, the new college is totally online. And if you want to learn about natural health for yourself or for your friends, or if they even go into business for yourself, we train you to do that. Just give me a call.
No, it's all good. And so with that, Dr. Kevin, I'm gonna get a couple of announcements in here that are important. As long as you got that pencil and paper handy, jot this date down. It's Friday, January 29th, and it's the parking lot of the Melbourne Auditorium. What am I talking about? I'm talking about the unique drive-through senior expo that a longtime friend of helping seniors, Nina Varuso with Platinum Events Productions is putting together. And so we will be out there as Helping Seniors of Brevard. It's a drive-through expo, so it's going to be safe. You know, you drive through with your car and you pop by the different stations, and they will give you things there. So it's a fun and safe way to receive information and resources, even while we're enduring all this COVID stuff here. So there's lots of information, promotional items, social distancing, other safety protocol guidelines. Everybody's going to be doing the face masks and those kind of things throughout it, so we keep it safe and fun. So seniors and elder adults are invited to drive their vehicles through the designated area, visit the sponsored tent stations. Those attending will get a giveaway bag full of resources, free promotional items for sponsors and vendors. A fresh coffee station is handing out coffee and bottles of water to the first 400 cars. So safety is first priority. All attendees will remain in their vehicles, and we'll put items in the trunk or back seat is how they're explaining it's going to go. So again, it's going to be from, I believe it's 9 a.m. to 11:30 a.m. Friday, January 29th at the parking lot of the Melbourne Auditorium. We will be out there as Helping Seniors of Brevard. We are actually tasked with providing out the February issues of Senior Scene magazine, in which your article, Dr. Kevin Kilday, that we've been talking about, Seniors Can Keep Their Brain Sharp, will be in that edition, so you'll be able to pick that up. We're also planning, by the way, to have one of the Helping Seniors car raffle cars for 2021 out there as well. So you'll be able to cruise past that. Now, again, if you haven't heard, this is another great date for you to write down on your calendar. It is Saturday, October 9th. That is going to be the Helping Seniors grand drawing date for the Helping Seniors car raffle. So you will be able to actually get tickets first. Actually right there on the 29th at that event. Maybe that's the lucky day to get your tickets. Be the first people to get your tickets for that. But it's going to be great because the 2021 Helping Seniors car raffle, Joe Steckler, our founder and president, has been hard at work. Even though he's busy, hard at work, 3 hours a day, they're working him on his physical therapy as he gets through the knee operation, and he's got a bunch of articles and things he's going to tell you, some do's and don'ts and things that you want to know about things like this as well in the articles that he's writing that you're going to be seeing in the coming weeks and months. But in particular, he's also been hard at work getting everything set up for the car raffle. In fact, we have great news to share that due to popular demand, Joe and AJ have worked out that we're going to do actually the exact same cars we did last year, except 2021 models, of course, now because we are in 2021. So that means the winner will pick their choice of a beautiful 2021 Chevrolet Camaro muscle car, a beautiful 2021 Dodge Challenger muscle car. If they want to be kind of cute and sporty, we got that 2021 Mazda Miata convertible. And if somebody is like, really, I need something I can lug things around in that's stylish and practical and great fun, we have the lovely 2021 Kia Sportage. So there's going to be great cars in the car raffle. Details are coming really soon. We're getting the web pages and everything all built up. But on the 29th of January is a good time to come out and see one or two of the cars that we're going to have out there at that senior drive-through. So we have we're kind of actually wrapping it up for today. We're really out of time, but Dr. Kevin, real quickly, one last time, your phone number is in case people want to get in touch with Holistic Health Center.
Yes, the Holistic Health Center is 321-549-0711. Again, that's 321-549-0711. And the website is holistichealthcenter.us.
Good. All right. Well, thank you, Dr. Kevin Kilday, Holistic Health Center. Thank you, John Harper, Jim Votro, the entire team here. Thank you, Joe Steckler, for just being the guiding light and visionary and helping us get the car raffle going. And we'll see you next week on Helping Seniors Radio.